And good morning, everybody. Thank you so much for being here this morning. I apologize, we're starting a couple minutes late today. It's been one heck of a morning for me, but luckily we are joined today by Ellen and Patricia. I'm going to let them introduce themselves just so I don't mess up any of either of their titles. So, ladies, go ahead and take it away and just let us know if you're okay with people interjecting to ask questions, like when they type in the chat box, if you want me to interject or wait to the end, you let us know. We're all ears. And everybody, if you'll join me in what'll be a silent clap, but we know everybody's clapping for Ellen and Patricia. Yay!
So much, Sarah. I can go first, and thank you everyone for joining us this morning. My name is Patricia Biondo, and I am the research manager for palliative medicine at the University of Calgary. And I've also been supporting some work out of the Covenant Health Palliative Institute for about the last 4 to 5 years. So over to you, Ellen.
Thanks, Trish. My name is Ellen Mee, and I'm a project coordinator at the Covenant Health Palliative Institute, and I mainly support the advanced care planning grant initiatives.
Excellent. All right. Well, we're going to get right on with it. So, ladies, are you okay with me? Because I'll monitor the chat box throughout the presentation. And when people have questions, would you like me to interject as they have questions or save them all for the end?
So I'm sort of doing the first half of the presentation, and I have kind of a spot for reflection and comments and questions at that point. So maybe if we pause kind of halfway through and then again at the end, will that work?
Perfect. Yeah, absolutely.
Okay.
All right. Thank you so much.
Right.
And take it away.
Thanks so much, Sarah. Yeah, so our presentation today is called Compassion in Action, Advancing Public Understanding of Palliative Care with the Covenant Health Palliative Institute. So yeah, thank you so much for having us, and we're so glad to be here, that all of you have joined us today to learn more about palliative care. So next slide, Ellen. And we'd like to start with a land acknowledgement. So Ellen and I and the rest of our team from the Covenant Health Palliative Institute are grateful to live and work on Treaty 6 and Treaty 7 territories. Treaty 6 is the traditional gathering place and home of the Cree, the Saulteaux, the Blackfoot, the Dene, Nakota Sioux, Métis, and Inuit peoples. And Treaty 7 is the traditional home of the Blackfoot, the Tsuut'ina, the Stoney Nakoda, and Métis peoples. And as settlers, we recognize the harms that have come to Indigenous peoples from colonization, including our own ancestors. And so we continue to take steps in our personal and professional lives to work towards reconciliation. Next slide, Ellen, thanks. So turning to the outline of our presentation. So as I mentioned, I'll kind of take the first half and I'll speak just a little bit about what is the Palliative Institute, who we are, so you know a little bit about who we are and where we're from, and then we'll turn to what is palliative care and how can it benefit people, and where can you go for more information and learn more. And then I'll turn it over to Ellen, who's going to speak to how people can build community support for themselves, their loved ones, people close to them who may be living with serious illness. And then hopefully we'll have some time for more questions and discussion at the end. So next slide. Yeah, so what is the Palliative Institute? So the Palliative Institute is part of Covenant Health, which is a public healthcare provider that works in partnership with Alberta Health Services. Covenant Health operates a number of hospitals and continuing care sites across the province. So, for example, you may be familiar with the Banff Springs Hospital. That's a Covenant Health facility. There's also a couple of hospitals in Edmonton, the Grey Nuns, the Misericordia. Those are Covenant Health sites. And the Palliative Institute itself, we're not a healthcare facility. We're not a medical facility. We quite often get asked about that. So we ourselves don't provide frontline medical care, but we're a research, education, and public advocacy hub for palliative care. And that graphic on the right highlights the 5 core activities that the Palliative Institute focuses on. So providing education around palliative care, conducting research, guiding policy development around palliative and end-of-life care, doing community outreach, and then supporting clinicians around the area of palliative and end-of-life care. And over the last, I guess, almost 5 years now, the Palliative Institute has received funding from the government of Alberta to undertake 2 initiatives related to raising public awareness of advanced care planning and palliative care. So that's why we're here today. Over our next slide, Ellen. Yeah, so improving understanding of palliative care. Why are we even doing this? Why is this important? So we know that that there's a lot of misconceptions around palliative care, and that many people who could benefit from it are not aware of the supports that it offers and how to access it. And we know that many people are often not being offered palliative care in a timely manner, or not accepting it, even if it is offered. And so that's kind of the reason for this work. So over to what is palliative care. So in its simplest terms, palliative care is care to relieve the symptoms and stress of living with a serious illness. So symptoms can include physical symptoms, things like fatigue or pain or nausea. Stress can include emotional concerns, social, spiritual concerns that someone may have when they're diagnosed with a serious illness. And so palliative care can help with all of those. It's really an approach to care that focuses on quality of life. So trying to help people maintain or have the best quality of life possible while living with their serious illness, where quality of life is really defined by each individual person based on what's most important to them. Next slide, Ellen. So a few facts about palliative care. So palliative care is for every age and every stage. So it's for people of all ages and abilities. So that includes children, the elderly, everyone in between. And it can be available from the time of diagnosis with a serious illness. You can receive palliative care alongside other treatments that you might be having for your illness. And it's often referred to as an extra layer of support that can help people live as well as possible. And then also importantly, palliative care also provides comfort and care at the end of life. So palliative care is really holistic care. It's care about the whole person. So as I mentioned off the top, palliative care can help with people's physical symptoms, but it can also help with all these other domains: emotional, social, cultural, spiritual concerns, recognizing that these are all interconnected and affect someone's well-being. So some examples of how palliative care can help in some of those other domains. So in terms of emotional concerns, sometimes people will experience distress, anxiety, depression, or grief when they receive a serious illness diagnosis. And so palliative care can help people work through those emotions, to learn more about their illness and what's how it might progress, and what's maybe what they can expect, and also help families too, right? Talking with your family about your illness or other close people in your lives. Palliative care can help people maintain social connection and social activities while they're living with their illness. Can also help people with any cultural concerns. So helping to make sure that any important cultural practices are able to continue to be that people can continue to take part in them and enjoy them as they're living with their illness. And then similarly, spiritual concerns. So sometimes when someone gets a diagnosis of a serious illness, they might ask questions about why is this happening, or they might feel like, they might feel a loss of meaning or joy in their life. And so palliative care can help people to maintain meaning and purpose and find joy. So next slide, Ellen. Yeah, so who provides palliative care? So there's a number of different healthcare providers that can all play a role in providing palliative care, and they're shown here on the screen. So family doctors, nurses, social workers, even volunteers, therapists, like physical occupational therapists, paramedics, and spiritual care providers. And then some healthcare providers have undergone additional training in palliative care, and they're called palliative care specialists. And they're able to help people who may be experiencing more complex issues. And not everybody may need to see a palliative care specialist, but there is generalist and specialist palliative care across the province of Alberta. So next slide. Yeah, so how is palliative care accessed in Alberta? I'm going to just preface this section a little bit with it depends. It depends a little bit on where you live in the province, and also a little bit on what type of illness you have. The specialist palliative care services do vary by health zone, and we'll talk about that in a moment. And then also in terms of illness, for example, if someone is living with cancer, the cancer centers across the province, many of them have special palliative care specialists within the cancer centers that can see people while they're coming to the cancer center for treatment. And then there's also a few, I guess, sort of new specialty clinics that are starting up for certain illnesses. So I know there's a new advanced care team for people with Parkinson's that's in Calgary. So yeah, there's a little bit of it depends, but a good place to start is to talk with your family doctor, primary care provider, or other healthcare providers if you're seeing a specialist for your illness, and indicate to them that you think you could benefit from additional support for those domains, right? So physical, emotional, social, cultural, spiritual concerns. A really good resource is the Alberta Health Services palliative care page, and we'll show you a couple screenshots of that in just a moment, but it's very comprehensive and goes into detail on the different palliative care services throughout the province. Also, the My Health Alberta page, so the myhealth.alberta.ca page on palliative care is really good to learn more about what is palliative care and is it right for you. And there's also the Alberta Health Services palliative care provincial team also has an email, this palliative.care@ahs.ca. You can always reach out to that email if you have questions, concerns about accessing palliative care. I will say that sometimes we hear from people that they may get a little bit of pushback from healthcare providers. They may hear things like, oh, you don't need palliative care, or, oh, it's too early for that, or you're not there yet, or, and I would say if you do hear things like that, just be persistent. Maybe try another member of your healthcare team. Again, you can contact that email and they can likely give you some tips. And also, I would just say be compassionate with your healthcare teams as well. We know that many healthcare providers are still learning and still maybe not fully aware of the full scope of palliative care and how it can benefit people. So next slide. Yeah, so this is a screenshot of the Alberta Health Services palliative and end-of-life care webpage. So it has these sections that you can click on. So it goes into the care options that are available in Alberta, and then this find a service. So that's finding services in your zone. We'll show you a screenshot of that after. And then there's a number of additional links under that, resources and support. So I'd encourage you to check that out as well. And then their contact information. And there's the link there on the bottom. Next slide. Yeah, so if you click on that find a service, you're going to see this kind of screen on the left that talks about services for adults, for people under 18, and then all ages. And so it basically is a bit of a breakdown of the different types of palliative care services that are available across the province. So there are palliative home care programs where people can come into your home and help look after you. There's hospice care, which generally refers to a facility, so a facility where you can go and live and be looked after, generally at the very end of life. There's palliative consult teams, so these are specialists that can consult, can just do one or a few consultations and then work with the rest of your healthcare team. And then there's specialized palliative care programs. These are generally more in the hospital, so hospital units that are there to deal with some of the more very complex issues that people can have. So if you click on each of those, it'll take you to the right-hand part of the screen that then is divided by zone. So you can click on the zone that you're living in, and it'll give you a breakdown of the types of services that are available in your area. I should mention Calgary and Edmonton both have specialist palliative home care programs, and people can self-refer to those. You don't need a referral from a healthcare provider. So if you think that you or someone you know could benefit from palliative care, you can reach out to them directly, and then they can work with you to see how they can help you. Yeah, and just wrapping up this section about what is palliative care. Sometimes when we do these presentations, we get asked this question about what's the difference between palliative care and hospice care and MAID, that's medical assistance in dying. So again, palliative care is care to relieve suffering and manage symptoms and improve quality of life for anybody with a serious illness. Whereas hospice care, as I mentioned before, is in Alberta, it tends to refer more to that facility-based care. So it's more a location. Hospices tend to be locations where people go and be looked after. And it's generally for the very final stage of terminal illness. So people who have a prognosis of 6 months or less. Many communities across Alberta have freestanding hospices. So like a residential hospice facility. Some smaller locations in Alberta, they may not have a freestanding hospice, but they likely have designated hospice beds within their hospitals. And then medical assistance in dying, or MAID, is a procedure that involves a doctor or a nurse practitioner administering a medication to cause someone's death. And there's federal law that outlines the criteria for medical assistance in dying. And I would suggest, so Alberta Health Services has a very comprehensive website on medical assistance in dying. And so I would suggest that if you're interested in learning more about that or have any curiosities, you can check out their website. Next slide, Ellen. Yeah, so if we do, there's a number of resources available if we've piqued your interest and you're wanting to learn more about palliative care, more than what we've talked about today. So we'll tell you about a couple of them. So the first one is a new resource that the Palliative Institute developed just a couple of years ago. It's an online module, so it lives on our website, and it's called Understanding Palliative Care. And it was created specifically for the general public. So we've tried to use very clear, non-technical language. It's very interactive. There's a number of things you can click on, and it's self-directed. You can go through it at your own pace. And it's multimedia. We incorporated a number of videos of real Albertans who have benefited from palliative care. And so and it's not too onerous to go through. I think the entire module, if you watch all of the videos, I think maybe maximum 20 minutes to go through. So it's not super onerous. So next slide, Ellen. Yeah, and the heart of the module really focuses again on that holistic support that palliative care provides. So supporting people with their physical, emotional, social, and spiritual concerns. And if you go to the next slide, Ellen. Yeah, so as I mentioned, we interviewed three Albertans for the module. And at the end of our interviews with them, we asked them this question: what do you think everybody should know about palliative care? And we got some really great answers. And so we compiled that into a short video. And we thought we would just play you a little clip of that video now so you could kind of get a flavor of the information in the module. And so in this video, you'll hear two of our interviewees, Bill and Colleen.
Palliative care still includes intervention. We're not stopping all medical efforts. It's not giving up on someone. It's doing what's best for them.
I think that's the big misconception about palliative care. As soon as they hear that phrase, they think that the end is near, and it's a negative thing. And I thought, in fact, I see it as a positive, because it's there to improve my quality of life. It makes your life so much easier during an incredibly stressful time.
That's a bit of a teaser. So yeah, check out the module if you want to see, want to see more there. And then the other resource we wanted to highlight for you is something called PalliLearn. And PalliLearn is a series of community education courses. They're courses for the general public. They were developed by an organization in Australia, Palliative Care South Australia. And we have an agreement, the Palliative Institute has an agreement with Palliative Care South Australia to adapt these courses for the Alberta context. And so we've adapted 4 of their courses for Alberta. And I think, Ellen, you're going to talk a little bit more about that in your section. These courses can be offered, they have been offered online, or they can be offered in person. We have a training program where we've trained healthcare providers to become PalliLearn facilitators, and now they're starting to offer these courses in collaboration with community organizations throughout the province. And so Unison is actually going to be hosting this series of 4 PalliLearn courses later in the year, I think from November to February. And so they're about 90 minutes in length. And so one of the courses in the series is what's on the screen here. So what is palliative care? And so this course goes into a bit more detail than what we've talked about today, helping people learn about what palliative care is and the benefits it offers and how they can access it. So I think, yeah, that one is coming up. That one will be in January 2026. So yeah, keep an eye out for that if that's at all of interest to you. So I think, yeah, so we're at our reflection point. So happy to take any questions or comments or thoughts that have come up for people from that section. We just have this prompt on the screen. Was there anything that surprised you about what you've heard about palliative care?
I love that. Now, while anybody is typing in their chat box, I'll take this moment just to kind of fill this space to say that I rarely think, like, when I think of palliative care, it's always just like end of life care. I didn't think about those stages, you know what I mean? Like, it can be at any time that you can have somebody come and if you've got a terminal illness, or it doesn't have to be, when you're ready for hospice. And that's because that's personally what I have experience with is hospice care, and that's is like end of life. And you're right, that is location, but I always forget about those 3 different branches and how important each of them are. So I really appreciated just seeing that on the screen, having the visual, and having you chat about it as well. So thank you so much, Patricia.
Yeah, no, you're not alone. I mean, I think the field of palliative care, I mean, really started with the hospice movement, which mainly for people living with cancer, but it's really grown over the years, right? So that's why we're here today. We're trying to let people know that it's not just for end of life. It's and there's been some really important clinical trials that have shown the benefits of palliative care when offered really early, like right at that diagnosis stage. So yeah, that's why we're trying to get the word out.
Absolutely. Well, even to have, like you said, at that early stage, to have somebody that's a professional, because that can be quite a shocking, diagnosis for people, like for the person themselves and the family members. So I loved that video where that, that lady was talking about, how it was such a positive experience and it just kind of relieved some of the stress and the burden off of her and her family. I think that's so important, especially in that position that you're in. Nobody really knows how to deal with death, and especially when it's a loved one, even if you're, a professional and you deal, with death often, it's so different when it's somebody that is your family or your friend or somebody that has a significant, part of your life and your heart. So, yeah, I love that young lady in that video that you shared was like, it's such a it can be a positive experience. I mean, death is very somber, and it's very sad, of course, but it's only sad for those of us that are living.
So for the last little bit of this presentation, we'll kind of switch gears and talk about building community support networks for those who are living with serious illnesses. For this slide, this clock graphic illustrates when people are unwell, most care happens outside of professional care. So professional support is typically available a fraction of the time to provide direct support to the person, their caregivers, and those close to them. Even when someone is in the hospital, how much of the time is there a professional healthcare provider in the room with them? Communities provide the majority of companionship and care. In fact, Pallium Canada explains that family caregivers provide more than 80% of care needed by patients with serious illness or long-term conditions. Integration of professional and community care better supports patients and caregivers. There's certainly an important role for professional support for those who are seriously ill, but the best case scenario is for someone to have both professional and community support. Those closest to them can often provide the best and most personalized care as they know them the best. This is often who people want to spend their time with as well, and not a paid professional, but people who know them best. And as Trish mentioned earlier in the presentation, palliative care is about holistic care. And so this slide showcases how care should be about the whole person and how support can be offered across multiple dimensions to enhance a person's well-being. Some of the various dimensions support can be offered include physical, and that includes delivering meals, groceries, helping out with yard work or snow removal, walking their dog. Emotional support, and this includes offering a listening ear, accompanying them to appointments, sending thoughtful gestures such as text, cards, flowers, or gifts. Social support, spending quality time together, engaging in shared hobbies or activities, and organizing group visits or video calls. Cultural support includes sharing favorite cultural foods, providing food or music in their first language, or bringing cultural events or ceremonies to them. And lastly, spiritual support include praying, meditating, or smudging together, spending time in nature, or arranging visits from spiritual or faith leaders. And this slide kind of talks a little bit about community support networks. So one way to think about how we can build community support networks is to think about building circles of care. The person who is sick and their primary caregivers are usually at the center, surrounded by the different layers of support. So I'll just quickly kind of go through each of the layers. Surrounding the central person and their caregivers is the inner network of people who are closest to them. So some questions you can ask yourself to assess who is in your inner circle include: who would you be comfortable seeing in your pajamas? And who would you want to remain in direct contact with, even if you are very unwell? These people are often in your inner network. The outer network are people who are not as close as the inner network, but are still personally connected to you. So the outer network may be more likely to help with less intimate tasks, especially activities outside of the home, for example, dropping off meals, running errands, or shoveling snow. And these could include neighbors, coworkers, friends, and extended family. The next layer is the wider community. People within the wider community may be strangers to some family members, but there are some degrees of separation. You may be only one or two people. And they might be part of your faith community, social club, or community volunteer group. Some needs won't be met by the inner circles and might require professional support, such as medical, nursing, personal care, or spiritual care. So it is often a good idea to kind of think about what your community support networks are, or if you are helping somebody, to understand what their support networks are. And so the entire PalliLearn series, as Trish mentioned, is intended to help caregivers or individuals understand what palliative care is and how to support those who are experiencing serious illnesses. And so this course specifically is intended to help build community support for people who are sick, dying, or caregiving. And so it's called Your Role in a Compassionate Community. And the goals of this course is to help people understand and understand what it means to be a part of a compassionate community. And that often exploring and thinking about that circle of care graphic from the previous slide. Also, one of the goals is to gain confidence to respond compassionately to people who are sick, dying, caregiving, or grieving, and to identify some of the practical ways to offer meaningful support. Another is to recognize that being part of a compassionate community includes individual and collective action. Long-term support for people is sustainable when it comes to coordinated support from family, friends, and neighbors, as well as community groups and support services. So Unison has set up a PalliLearn series in November to February, and all of the dates as well as the sessions are listed on this slide. The dates and registration links can also be found on the Unison website closer to these dates under the Programs and Events section. So this slide kind of talks about other resources to help coordinate communication and support. And it can be helpful for many different people and groups. These online tools include Lots of Helping Hands and Caring Bridge. And these tools can be convenient ways to communicate updates or requests for help, as well as coordinate support. For example, meals, rides to appointments, respite care, or social visits at appropriate times. Another tool is called My Collaborative Care Plan, which is a tool that can help identify if someone has unmet needs or would benefit from additional help. So examples could be what roles can be played by the different members within their social circle, and is there a need for additional support from the community? Some other additional supports you can find in your community include local hospice or palliative care societies. They offer respite care or companionship, as well as grief support programs. Disease-specific organizations. There are many organizations that offer resources and support to people in Alberta with specific conditions, such as cancer. One organization is Wellspring, or Alzheimer's. Sorry. And that would be the Alzheimer's Society, ALS, kidney disease, and more. Caregivers Alberta is also a tremendous source of information and support for people who are family or unpaid caregivers. There's also family and community support services, Meals on Wheels, faith or cultural community groups, which are tremendous sources of support for many people. Friendship centers, which is a community hub and resource for Indigenous people and also newcomer organizations. There are also many others that you can look into within your community. So this section will kind of talk about some other resources that are readily available to you in Alberta. one of which is the Compassionate Alberta website, where you can find information on palliative care under the Learn About Palliative Care section and Advanced Care Planning under the Plan Ahead section. Other advanced care planning resources, which is also another important part of palliative care, can be found on My Health Alberta website under Advanced Care Planning, and Advanced Care Planning Canada, which has a bunch of resources for future care decision making. Other resources that are available include Canadian Virtual Hospice. This website or group provides support and information about advanced illnesses, palliative care, and grief. My Health Alberta also has a palliative care section, which has information regarding palliative care in Alberta, and 211 Alberta. So this is a directory that is available through calling or online, and it's available to provide numbers or information about community services within your community. And so that concludes our presentation. If you have any questions or comments about what we shared, feel free to contact us at these email addresses. You can either contact Trish Biondo at her email address, or myself, Ellen Mee, at my email address. Or if you have any general inquiries, you can also email the Palliative Institute website, or the Palliative Institute email address. Thank you very much for attending, and we hope that you have a wonderful afternoon.